Hi, I'm Lynn Fishman. Thank you for joining us. I'm coming to you from the 40th Annual International Conference on Wellness and Consciousness Studies here in Montreal, Quebec. This conference is sponsored by the International Institute of Integral Human Sciences. This is the place to be to get inspired with practical tools to live your best life. I am super excited to tell you that I'm here with Dr. Raymond Moody. Dr. Moody is a psychiatrist, the father and pioneer of near-death research, a prolific author, and an international speaker. Dr. Moody, so glad to have you here.
So good to be with you, Lynn,
Yes.
as usual, as always.
It's been a busy day.
It has been, but we've
busy
had
day.
a good time.
So, Dr. Moody, let's talk a little bit about near-death experience. Where are we in our research in 2015?
I think the most important recent development in near-death studies has been the medicalization of interest in this. Recently, the Missouri Medicine Journal, which is one of the best medical journals in the United States, has had an 18-month series of articles by physicians who have either studied near-death experiences or who have had near-death experiences. So this is now, in a way, has aroused an entirely new level of interest among medical doctors. Plus, I have so many cases of medical doctors who have told me incredible things about their events in which they resuscitated their patients and that they seem to empathically co-live the experience in some way. For example, in Italy recently, I talked to a surgeon, and after my lecture on near-death experiences, he took me aside to a corner, and his eyes were very haunted, if I could say that, just like you tell he had been through a startling experience. And what he told me was that he said that some months before, he had been performing an operation on a healthy man who was not very old, and it was an elective surgery. It wasn't anything very serious. So there was no thought whatsoever that the man would get into trouble. But in the event, the patient had a cardiac arrest on the table, and the surgeon was not able to resuscitate him. So after a while, he gave up on the resuscitation, and he was having all these feelings like, how did this happen, and what am I going to tell the family, and doing the paperwork. Whereupon he said that whereupon the surgery doors opened, the doors to the operating room, and a woman came through, and the surgeon told me at first he thought that this woman was psychotic, or he was like that she was a lunatic and that she was raving. And he said, what is this? And he said, as he tried to listen to what she was saying, that what she was saying was, she said, my husband is not dead. She said, I was in the waiting room and my husband came to me and he said for me to come in here and to tell you that he's not dead. And so the surgeon was so startled that he automatically reinstituted the resuscitation, and to his astonishment, the patient revived. And he said when the patient was coming to or waking up in the recovery room, he said the patient said to him, I was out of my body looking at you and you couldn't hear me, and I was trying to tell you I was not dead. So when you couldn't hear me, I went out to the waiting room and I told my wife to come in here and to tell you that I'm not dead. And I have other cases too where the medical doctors experience something concurrently at the same time that the patient was having a near-death experience.
Right, and you've termed this shared death experience.
Shared death
Right.
experiences, yes.
So what are the implications of this of shared death experiences for the whole field of near-death research? What does this mean for us?
I think first and foremost, in terms of the explanation of this clearly undermines the standard counter-explanation of near-death experiences that they have to do with the compromise of the oxygen flow to the patient's brain. Because the bystanders are not ill or injured, the surgeon was not ill or injured, and yet he had an encounter with this patient. So we're obviously dealing with something here that is more than simply the oxygen cut off to the brain, because in many cases, bystanders have these near-death experiences as well when the dying patient does, and there's no question of a cutoff of the oxygen flow to their brain.
Of course, that's how it would seem.
Yes.
It would appear so. And you have a book on shared death experiences?
Yes, it's called Glimpses of Eternity,
Right.
and it's with my co-author Paul Perry.
Right, which I highly recommend, and the focus is all on these
Shared death experiences. Yes.
That's wonderful. And what's new for Dr. Raymond Moody now in 2015? Is there anything you can share with our audience?
Well, yes, I can very confidently say that the big problem with the rational understanding of the question of life after death is not scientific but conceptual. It's a logical problem rather than a scientific problem, at least in 2015. And what I'm very happy to say is that there are now new rational principles that it can enable us to think logically about this question of life after death. So I think the next big breakthrough in near-death studies is going to come from new forms of logic that can help us understand these experiences in an entirely new way. We can actually now restructure the human mind to a degree that enables us to think logically and rationally about the biggest question of existence.
Mm-hmm. Yes, I know you were talking about how near-death experience has been largely a narrative.
Yes.
And that we need more of a
Concepts.
Yes, concepts.
Yeah.
So that's where you see this going.
I do.
Wonderful.
Yes.
And you're going to be a part of this.
Yes, I suppose. That's up to God, isn't it?
Right.
I just have reached the point in my life where the best policy is to surrender to the Lord and let your life play out that way.
Right.
I'm just here to do a role as my focus is on my 17-year-old and my 14-year-old.
Right.
My grown kids are grown and on their own. I've got a wonderful grandson. He's got his parents. I'm responsible now for a 17 and a 14-year-old, and that's why I'm living.
I can relate to that. But your work has been outstanding.
Thank you.
Really is. As a health professional, I can truly
sweetie.
say it made a big impact on my nursing profession.
Thank you so much,
Really
sweetie.
has. I actually have a couple of questions from our audience members, if I may.
Yeah, sure.
Okay. So.
And by the way, I would hope that everyone listening to this and watching this will make some effort to come to the next conference that we give and to maintain contact with our organization.
Thank you. Yes, this is the place to be. It's we've always been an avant-garde conference, and it continues to be so. And now more than ever, we need to learn and associate with others who are looking to make the world a better place and looking to make their lives a better place, and it's so important. So here, our first question comes from Sharon, and she asks, what is the most famous near-death experience in history?
I think it's probably the story in Plato's Republic of the warrior who was apparently killed on the battlefield, but during his funeral he sat up and he told the story of leaving his body and going through a passageway into another world where he saw his life reviewed. And not just Plato, but numerous early Greek philosophers were fascinated by this case. He certainly is the most famous, I think.
Interesting. And what I've learned from you is that this question of near-death experiences, it's not something recent.
No.
This is going back to the early Greek philosophers.
Absolutely, and they debated it in the same way. Plato looked at these experiences and he took it at face value as indicators of an afterlife. But meanwhile, his contemporary Democritus, who was the founder of atomic theory, said there's no such thing as a moment of death, implying that what these near-death experiences were was simply the artifact of the winding down process of the body.
And the debate begins.
And the debate begins. And it's still the same debate.
Oh, wow. Okay, the next question is, how can the non-fear of death change the world for the better? Or can it?
Mm-hmm. You know, I think that different people fear different things when they say they fear death. Some people fear the pain that they feel might be associated with it.
Mm.
Other people fear being separated from their loved ones.
Mm-hmm.
Some people fear that they might go to some terrible hell. And some people are just fearful of the unknown. Some people are fearful of the loss of control. But whatever the basis of the fear is, I think that the prevalence of these near-death experiences can give us a better way of living. In my psychiatric practice, I've seen a lot of people how their fear of death really prevents them from living a full life.
Mm-hmm.
But when the fear of death goes, you can live a much richer and happier life.
Well, I think you've answered my last question. And I'm just going to get my glasses for this one. Nancy writes, how can conversations about death and dying begin at an earlier age instead of being seen as something to be afraid of? I think the fear of death and dying that is so prevalent in our society makes it difficult to reach the next level of embracing life.
That's a wonderful thought. And I don't know the answer, but the thought that we might introduce these ideas about near-death experiences to children at a very young age,
Mm-hmm.
I think that's a very intriguing idea.
Okay.
I wouldn't know how you would go about doing it because I'm not an expert on children and so on, but I bet you that a good children's author and maybe pediatrician or whatever who specializes this would be able to present this material to children in a way that would be very helpful.
Mm-hmm. It would.
And I know that people who have near-death experiences as children, for the rest of their lives, it's a very big part of their life, that they very early in life learn that there's nothing to fear in death.
Mm-hmm. That's powerful. So Dr. Moody, share with our audience where we can reach you. How can you be reached?
You know, my web address or my email address is raymondnde@aol.com, and I would love to communicate with anybody who writes.
Right, and Dr. Moody also has a Facebook page where we can come and read up on what's new with you.
That's right, I do. I'll just be quite honest to you, Lynn. I don't even use computers myself. I still write longhand. But what happens is that somebody gives me the communications and then I write back.
Perfect,
So.
because that I see your updates on what you're up to, because you're always busy.
Yeah.
Well, I want to thank you so much for
Thank
doing
you,
this
Lynn.
for us. We were so
Thank
pleased
you,
to have
sweetie.
you.
It's always
We
good to
love
be
you.
with you.
We love you.
I love you, darling.
And I want to say thank you to you too. Thanks for joining us, and hope to see you at the conference this year or next year coming. Bye for now.
Bye-bye.